did my case study presentation on my client, PR. PR is a 62-year-old male of Italian-Irish descent who currently resides on Long Island with his wife of over 30 years. He's a father to a 30-year-old daughter and a 33-year-old son, and he speaks English. He obtained his collegiate degree at Baruch and John Jay and is a retired elementary school teacher. Socially, he's very social and talkative, reports that he's outgoing, and loves to be around others and spend time with his friends and family, which has since been negatively impacted by his diagnosis. Personally, he loves to read, go to dinner with friends, and he loves to be active. He was diagnosed with primary progressive aphasia, PPA, by a neurologist in November of 2021, specifically lagopenic variant of PPA, LVPPA. The cause of PPA in his case is unknown, and he also has heart disease, which he currently has 2 stents, hypertension, high cholesterol, and the medications he is currently on are listed below. PPA is a progressive neurological syndrome that affects memory and language skills, and it's different from other types of aphasia in that it's not necessarily caused by a stroke or a brain injury. Rather, it results from dementia, and it's classified as a neurodegenerative disease. It results when the brain cells deteriorate, and this causes atrophy of brain tissue that is specifically essential for speech and language. And PPA has been associated with a number of degenerative conditions that primarily involve the perisylvian region of, again, we know speech and language, the left hemisphere. It's classified into 3 variants. So PR's diagnosis of lagopenic variant of PPA, non-fluent agrammatic PPA, and semantic variant PPA. Now, PPA initially presents itself as a mild speech and language impairment. However, language and memory deficits will continue to worsen and become more severe over time as the disease progresses, as it says in its name, to those later stages. Here's a chart of the clinical and neuropsychological features of the different variants of PPA. So as you can see, the right column over here is PR's case. Spontaneous speech, it's relatively okay. It's fluent. There are some phonological paraphasias, but other than that, it's okay. Rather, the hallmark features are there are deficits with word retrieval, as well as sentence comprehension and single word and sentence repetition. Now, single word repetition remains relatively okay in the earlier stages, but it will, but that's in comparison with sentence repetition. But it is also impaired as time goes on. Lagopenic variant of PPA is stated or seen by atrophy of the left posterior perisylvian or parietal area of the brain on an MRI. Now, the first hallmark feature of LVPPA is impaired single word retrieval. So the individual will have pauses or hesitations in their speech that are due to needing more time to retrieve words. The second hallmark feature is impaired verbal short-term memory, which presents as impaired repetition of phrases and sentences. The longer and more complex the phrases and sentences are, the more difficulty the person will have. Additionally, there's poor comprehension of complex sentences, but again, research has shown that this is more attributed to those deficits in impaired verbal short-term memory. There's also phonological speech errors and phonological paraphasias, but what remains intact is motor speech ability, single word comprehension, and simple grammar. PR was referred to the clinic after being diagnosed with LVPPA in November of 2021, and he was referred by his neurologist for speech and language therapy. He began his therapy in January 2022, and notes that his problems related to his diagnosis began in October of 2021, but since have gotten worse to the point where he doesn't really want to communicate much with others verbally. Specifically, his speech, language, and cognitive characteristics. So his wife states that he knows what he wants to communicate, but he cannot physically say it. And again, we know that this is not attributed to a motor speech issue, but is really referring to those word retrieval difficulties and specifically when communicating with others, his inability and difficulty with remembering what someone just said, so being able to respond. He often asks her to repeat what she had just said when conversing, which leads to communication breakdowns. And he states that his problems related to his PPA have caused him to not want to communicate verbally with others. He has extreme frustration and lowered self-esteem, which impacts his social life. Specifically, he states it's the word finding difficulties and difficulties understanding others when conversing, specifically in distracting, loud settings, or with multi speakers, or while performing a task, such as having a conversation with his wife while he's driving. And he states that there's difficulty completing tasks that involve communicating with others, such as like making a doctor's appointment. But it's not due to not understanding what the person said, but it's rather he doesn't remember what the person said. So he'll have a conversation about making an appointment with the doctor, hang up the phone, and not remember what time the appointment was. And this is something that didn't happen prior to his diagnosis. He relies on silent word retrieval strategies, but again, then this leads to communication breakdowns. And his comprehension deficits can be attributed to his verbal short term memory deficits, specifically phonological short term memory. So, rather, it's again not that he's not understanding due to a processing problem or a receptive language disorder, but rather due to the deficits in his verbal short term memory. And research does state that patients with LBPPA typically are more impaired than even individuals with Alzheimer's disease in all tasks that require phonological short term memory. So there were no formal tests administered throughout the semester, but rather previously he was administered the MMSE and the BDAA, but specifically certain subtests. And he scored in the low average range in all repetition subtests, as well as the digit span and spatial span subtests. So the clinician began by gathering baseline data to first establish rapport and to informally evaluate him. And she did note that in terms of word retrieval, he did experience word retrieval difficulties various times throughout the session, and he didn't employ the use of any strategy. And additionally, he did ask her to repeat herself when they were conversing at times due to saying, "I forgot what you just said." That was what was noted. So the goals, first and foremost, they are appropriate. I do agree with them. So long-term goal one, the client will increase word retrieval skills to maintain his communication skills and to express himself by employing word retrieval strategies for communication in social settings. Although I think it's a little bit of a mouthful, I do think it's really thorough and specific, and so I agree with it ultimately. So short-term goal one, the client will use the semantic feature analysis strategy for communication by verbally labeling at least 3 semantic features of a target word, provided pictures of different concrete and abstract items with 80% accuracy given minimal verbal prompts via extended response time. Short-term goal 2, the client will use multimodal communication to retrieve words for communication in social settings at the conversational level through role-playing scenarios representing routine social interactions with 80% accuracy given minimal verbal prompts via extended response time and verbal reminders. I agree because they're functional for the client. They also directly go along with his preferences of what he stated he really needs help with. And the goal promotes semantic circumlocution, which is self-cueing, which will help him in conversations with retrieving words, and that'll ultimately give him more communicative independence. Long-term goal 2 is the client will improve cognitive abilities and receptive auditory comprehension by employing internal and external memory strategies to maintain his communication skills in social settings and activities of daily living. Short-term goal, the client will improve short-term memory through listening to messages on the functional listening application, representing everyday routines and using chunking, grouping, and verbal rehearsal strategies to answer multiple choice questions based upon the messages with 80% accuracy, given verbal prompts via extended response time and modeling of memory strategies. Again, I agree because it's functional for the client, and we know for verbal short-term memory deficits specifically associated with phonological short-term memory are hallmark features of LBPPA and are one of PR's primary difficulties, as he stated. Additionally, I agree because the goal uses various evidence-based practice strategies in strengthening that have been shown in strengthening verbal short-term memory in patients with PPA. And in using various ones, it helps determine what's most helpful for the client. But these were the 2 that were chosen to start off with. And as you'll see, these actually were very helpful for the client. So he had 30-minute sessions twice a week individually at the clinic, where word retrieval treatment involved semantic feature analysis and multimodal communication strategies. And receptive comprehension, verbal short-term memory treatment involved listening to functional messages and verbally answering multiple choice questions with employing verbal memory strategies through the functional listening app. So, semantic feature analysis is a procedure that's used to train people to produce semantic information when they have difficulty accessing the specific word or label they want to say. So, rather, they describe each feature of a word in a systematic way by answering a set of questions. And based on the spreading activation theory, neural networks surrounding the word when they are activated will thus strengthen the retrieval of the target word. And SFA has been shown to generalize or improve word finding for words that haven't been practiced in therapy. So this is a really great treatment for him. So this is what it looks like. He was presented with this sheet where the picture was placed in the center, and PR attempts to name the item, and if he cannot, regardless of the response, you move on to the next step where the clinician asks him to provide a verbal response for each of these semantic features. So properties, location, association, action, use, and group. And he writes in the responses as they discuss them. Then, when completed, the clinician prompts PR to name the picture again. If he cannot, she provides a phonemic cue, and he'll try to name it again. If he cannot, the clinician will name it, and he repeats it back. Multimodal communication is the use of all or any other modalities to retrieve a word and communicate an intended message. So it involves switching among modalities to resolve communication breakdowns. So it's spoken language, writing, drawing, gesturing, anything that the client can use to communicate. It's important because it considers his prognosis in PPA, and it prepares the client to strengthen other communicative skills for when the effects from restorative treatment alone is no longer effective enough to resolve breakdowns. PR primarily used writing and gesturing, and also research shows that semantic feature analysis and multimodal communication strategies combined increases communicative effectiveness in individuals with LVPPA. So in this, they presented role-playing scenarios of a client's choice based on his everyday life and preferences. And this included being out to dinner with friends, ordering at a restaurant, etc. And when he was not able to retrieve the word, he was prompted and taught to use other modalities. So whether it was to write it down, to ask for a pen and paper, to draw, to gesture, to use body language. And he actually stated this really helped him a lot in his conversations with others, and that he was able to resolve it on his own if he couldn't retrieve the word. Then, in terms of receptive auditory comprehension and verbal short-term memory, functional listening can be used in speech therapy with individuals with stroke and other cognitive deficits. Specifically, verbal short-term memory deficits can contribute to deficits in receptive comprehension, as seen in PR's case. So the functional listening app was used, there's pictures of it here, where it includes listening exercises with everyday routine messages that an individual may hear throughout his life. So going to the store, making a doctor's appointment, at the doctor's office, being at school, out to dinner, various settings. And PR listened to the messages and then took a multiple choice comprehension quiz at the end of each message. Now, with this, you can select different types of background noises. So we did one where there was cars, so he's in the car, so there was traffic noise outside, and he was trying to listen to what a woman was saying. So it mimicked being in the car with his wife. And he actually noted improvements in receptive comprehension while performing tasks. So while cleaning and speaking with his wife, driving it, he actually noticed improvements after using the functional listening app. So it targets listening at the paragraph and sentence level in the context of an activity of daily living or a social interaction. So he practiced internal and external strategies while listening to the message on the app to increase his verbal short-term memory abilities. So the strategies that he used were both effective for him. Verbal rehearsal, which involved him repeating information over and over out loud, and chunking, which required him remembering items in groups, since that has been shown to be easier than remembering items separately. And this type of treatment has been shown to generalize over to conversing while performing a task, being in a multi-speaker setting, and other interactions aside from the ones practiced in therapy, because it strengthens his verbal short-term memory skills. Thus, he is able to retain what someone said to him more and thus respond. And these are my references.